Hello, everyone. Today I will speak about the potential national and global policies that can contribute to address the MASLD public health threat. I would like to start describing the current situation of steatotic liver disease worldwide. And it's important to recognize that around one-third of the adult population have MASLD. And also, the prevalence of the most relevant risk factors like diabetes and obesity, it's also high and rising in the recent years. It's important to also notice that the frequency of genetic polymorphisms that can increase the risk of MASLD and progression of liver disease, it's also high in some populations. For example, in Latin America, and the levels of alcohol use are high and sustained over time in most of the areas of the world. And we already know that even small quantities of alcohol can increase the progression of liver disease in people with MASLD. And when we see the reality of the public health policies on MASLD, unfortunately, the situation is not so good. If we see this article that was published 4 years ago, we can see that in 102 countries, none of them we find national policies in MASLD. And the performance in terms of preparedness for MASLD was extremely poor in one-third of the assessed countries. We know that India recently developed a national plan on MASLD and became the first country in have a public health policy on MASLD, but unfortunately, no other countries have implemented a national plan in this matter. We also need to recognize that some areas face specific local challenges. For example, in Latin America, we have an extremely high prevalence of obesity and diabetes. So it's important for us to have really good screening methods to identify people at higher risk of progression. And unfortunately, health system fragmentation is also a barrier to integrating a multidisciplinary care, dificulting the best care for people with MASLD. And when we see the current situation in terms of the establishment of public health policies in my region, we can see a very heterogeneous implementation. And you can also see that those policies are mainly focused in the non-communicable disease. And I think this is a good aspect to highlight because even if we don't have a national policy on MASLD, there are many policies related to MASLD, including those addressing physical inactivity, unhealthy diet, alcohol, smoking, and cancer. So if we are able to improve the policies in those areas, for sure we can level up the preparedness for the burden of MASLD. So I would like to briefly discuss about the potential actions that we can make to improve the strategies and policies addressing MASLD. The first one is to advocate for comprehensive policies, not only national plans in MASLD, but also in the related non-communicable diseases. And this should be a collaborative effort between scientific society with policymakers, government, and related groups. We need to also support local patient groups, especially those who are not visible, and promote a non-stigmatizing language. And In my perspective, this is one of the most important topics for physicians. And we need to improve the education and awareness for all healthcare providers. We need to improve the skills to address the cardiometabolic risk factors, to better quantify the levels of alcohol use, and for sure, identify people with a higher risk of progression. We also need more funding for invest in research, not only in the populations with higher representation. We need to develop research in areas that are not visible at this time. And we also need to tailor different models of care according to the different realities, including the screening strategies, and prioritize strategies to strengthen the primary care system. And finally, I think it's important to improve the treatment and care facilitating non-pharmacological and pharmacological treatments for MASLD and the related risk factors of this disease. That's what I want to discuss today, and thanks so much for your attention.